Okay, so today we're gonna do the abdomen. I'm gonna show y'all how to do that. Everything you're gonna need is gonna be in your sterile dressing kit that's here. I have Q-tips because for the abdomen we're gonna pack the wound, and I have a pair of sterile gloves. Even though there's a pair of sterile gloves that's in here, if these doesn't fit, make sure you bring your own pair of sterile gloves on checkoff day. All right, so the first thing you're always gonna do with anything, you're always gonna do white caps. So good morning, Mr. John. My name's Alicia. I'm gonna be your nurse on today. The doctor wants me to do your dressing change on your abdomen. I see here that you have a stage 4 that needs to be packed on today. Are you experiencing any pain? He said yes. What time did the nurse give you pain medication? So I got a report this morning, and the nurse told me that she did give him a Norco at 6:30. So now it's 10:30, and he can have it every 4 hours. So I'm gonna go and I'm gonna give him his Norco, then I'm gonna come back. Okay, so it's been 30 minutes, so it's 11 o'clock, so I'm about to do his dressing change on his abdomen. So Mr. John, how's your pain now? He said his pain's a 2. So it's tolerable enough for me to be able to go ahead and give him his do his pain medication along with his dressing. All right, Mr. John, this is probably going to take about 10 to 15 minutes for me to do your dressing change. I'm going to go quickly as I can so I don't overexpose you. Is that okay with you? Is there any cultural religion belief that is going to hinder me from taking care of you on today? He said no. He told me that he's just ready to be able to go home. So I'm going to get my things together. So I have done my hand hygiene. So now I have my clean gloves on because I need to do the assessment on his wound. So I'm going to pull his covers back so I can expose the abdomen. I'm going to tuck his gown up completely out the way because this is a sterile dressing change. I'm going to pull his brief back. If the patient had had a bowel movement or anything like that, then I would change him before I proceed on to his dressing change. All right, so I'm going to open his dressing away from him so he won't be able to see it. So I'm gently lifting the sides of the tape. And I'm going to pull back. And as I'm pulling back, you want to make sure you go slowly because you don't want anything popping in your face. So as I'm pulling back, I'm looking at any kind of drainage. So there is no drainage, there is no odor, and the wound is beefy red, so therefore it is healing well. So Mr. John, your wound is healing just fine. So I'm going to ball this dressing up in my hand. It goes in the glove. And at the end of the bag, I already have my red bag because whatever comes out of the body goes in a red bag. So that's going to go there. So I'm going to do hand hygiene again, and I'm going to get ready to start prepping. So I'm going to open my kit, open it away from me, utilizing my edges as my 1-inch border. I'm going to set that to the side. Once again, like I said, it has the sterile gloves in here. I'm not going to utilize these sterile gloves. I want to use my other sterile gloves that I have. So therefore, I'm just going to take the old gloves out. Just in case I need them for backup, I'm going to set them over there. I'm going to get my drape. First, I need to move this. I'm going to get my drape by my 1-inch border. Open it. Come around, and I'm just going to lay it there. Therefore, I have enough working room to do what I need to do without contaminating my sterile field. So I'm going to push this over here out of the way, and I'm going to go ahead and I'm going to open up my Q-tips because once I get my sterile gloves on, I cannot touch this. This is considered non-sterile. So I'm going to come to the side to prevent from crossing my sterile field, and I'm just going to open and let them fall. This is going to go in the trash. Now I'm ready to open up my gloves. I'm going to rub this here to kind of release it from the paper. I'm being careful so I do not touch my sterile field. So like I said, I am right-handed, so I'm going to glove my dominant hand first. So I'm going to pick up on the unsterile side, and I'm going to step back. My palms going down, and my arms are out in front of me. one sterile glove is on. Like I said, if you all need more working room, because all this is considered sterile, you can turn your glove this way, because it is sterile to sterile, to be able to unlift here, because you need to get up under here, which is the sterile to sterile. And as you're working it, hold the bottom of your paper so the does not slip and it does not go here or here. So my palms are completely under here. Step back, and as I'm going in, I'm going to wiggle my fingers in and then ease my thumb in here. And now I'm going to make my adjustments palm to palm. Never go to the back of the glove to make adjustments. It's always palm to palm, because these are considered sterile. So now at this point, I don't need this. So I'm going to gently move this completely out the way and drop. This arm stays in the air, completely safe. So now I need to move all of my things that's here to here. So I'm going to stick my hand on the inside of here, because this is considered sterile. And I'm going to pull all of this close to me. And I'm going to start turning it so I can get from here to here. So I don't need this red bag, but I'm going to go ahead and I'm going to set it to the side to be just in case. So I'm going to drop it there. I'm going to come around and I'm going to drop here. I need my ABD, drop there. I need my scissors. I'm going to drop that here. I need this is my gauze for my covering. I'm going to come around and I'm going to drop that there. I have my tape here and I'm just going to drop that there. And I have my saline solution and I'm going to have palm to the hand. So I need to, I'm not cleaning this because that's not what the doctor wants. He wants us to just pack it. So I'm going to pack based on what it looks like. The original packing only had 2 gauze, so that's what I'm going to shoot for, is 2 packings to make sure that the wound is completely covered. So at this point, label is the hand. I'm going to open here and I'm going to drop that there. I'm going to open here and I'm just going to drop that there on the table because I don't need it. Palm is still in the air to remain safe. And I'm going to pour my solution as ordered. I'm going to step back. I'm going to reach here to get my top. At this point, I'm going to sit it back on the sterile field just in case I need it again. So at this point, I'm going to come over and I'm going to sit it towards the corner. All right. So I need to pack with 2. Hands still out in front of me so I can see my hands. I'm going to reach in and I'm going to squeeze one of the 4x4s. I'm going to step away so I can be able to look and see what I'm doing. So actually I already have 2 in my hand, so that works out perfectly. I don't have to go back into my container. So the first one, you want to open it up the long way. Start curling it around your hands so you can have better control of your dressing when you begin to pack. So that's one dressing. And this is dressing number 2. I'm going to open up my gauze. I'm going to wrap this around so I have better control. And now I'm going to get my Q-tip. Now my Q-tip is right here, but I don't want to cross any of this. So I'm going to come around and I'm going to pick up my Q-tip. The main thing is making sure you still do not cross your sterile field. So my back is not turned. Everything is still close to me where I can have eyeball level. So I'm going to wrap this around and then I'm going to come down, start from the top and start placing the dressing, the packing inside of the wound. Now, if I'm dressing and if this flops over, I can no longer use this dressing. So as I was packing, it looks as if this may have touched the skin. So I'm going to need to take this out because I can no longer use it. So that will go there. So I have my second packing. And I'm going to try it again. And I'm going to go back in. And I'm going to be very careful eyeballing it to make sure that I do not touch the outside of the skin, because we do not want to drag any germs inside of the wound. So that's packing number 1. This one may have gotten soiled, so if it's soiled, I'm gonna go ahead and chunk it because I have a second one. So I'm gonna say that it did get soiled when we packing it, so I'm just gonna chunk it. I'm gonna reach back in here and get another gauze because I just need to pack with just 2. I'm gonna step away, the same procedures like before. And the main thing is you want to make sure that the dressing does not touch. Also, not only for the wound, but it depends on the type of solution that you're using to debride the wound. Certain debridement solutions can also damage the good skin. So you want to make sure that your dressing is where it's supposed to be. So once again, I'm going to come around. Everything is eyeball here. And I'm going to get my other Q-tip. And I'm going to come back around. And now I'm going to pack again. Paying attention to what I'm doing. I'm just going to unroll a little at a time. And now he's packed. I'm going to chunk. I'm going to use my gauze as my covering. So I need to come around. I'm going to pick it up here, come back around. And I'm eyeballing just about how much I need to cover the wound. I'm going to cut it. My scissors are here. It's not by anything. It was directly in my sight. So I'm going to drop back here. And I'm going to drop this back there. And I'm going to cover the wound. That is my 4x4. I have my ABD. And as you can see, I have 3 different things that's in the way. So I cannot go here. So I'm going to need to do the same thing I've been doing the whole time, which is going around. So I'm going to come back around to the side. And I'm going to pick up my ABD, come back around, and it's in my eyesight. Don't do this. Make sure that it's out where you can see it because you want everything to remain sterile. I'm going to now cover. Once again, at this point, if you can tape with your gloves on, you can. If you don't, it doesn't matter. I can't take the gloves off, so I'm going to take mine off. Because at the main thing, the wound is covered. So I'm going to chunk my gloves, and I have my tape that's here, so I'm going to begin to tape. And remember, you don't want a lot of tape on the patient's skin. So I'm going to tape here. I'm going to tape here. I'm going to tape at the bottom. And with my last piece of tape, I have my Sharpie. And I'm going to put a Turner RN because you're going to put your credentials, but on checkoff day, you all will put SN. Today's date is 10/26/22, and it is exactly 1906, which is 7:06. Take this down. Take my last piece of tape off. Place it on the patient. Fix my patient's brief back. Pull the gown back down. Cover my patient up, lift the bed down at its lowest setting, and document my findings.